Welcome to Pharmacy Review, your trusted source for simplifying pharmacy compliance and empowering pharmacy professionals. Today, we're diving into the diverse and fascinating world of pharmacy practice settings. From long-term care facilities and medical offices to the specialized realms of nuclear and remote pharmacy practice, we'll explore the unique roles and responsibilities pharmacists play in these settings. We'll also navigate the essential rules surrounding veterinary dispensing, emergency and urgent care, hospital discharge dispensing, and more. Plus, we'll touch on international drug sourcing and how pharmacy benefit managers, PBMs, shape the landscape of pharmaceutical care. Whether you're a pharmacy professional, student, or just curious about the pharmacy world, this is your one-stop guide. So, grab your notepad. Let's get started. Disclaimer: this channel provides educational content on pharmacy law, summarized by artificial intelligence. While efforts are made to ensure accuracy, information presented here may not be comprehensive or up to date with the latest legal developments. This content is for informational purposes only and does not constitute legal advice. Viewers should consult a licensed attorney or qualified professional for specific guidance related to pharmacy law and regulations. The creators of this channel are not liable for any actions taken based on the information provided. Always verify details with authoritative sources such as government regulations, professional organizations, or legal experts. Section 7. Other settings in pharmacy practice. Mail-order pharmacies. Mailing prescriptions, both in and out of state, is allowed. However, the pharmacy must use approved packaging to protect drug stability per USB Chapter 1079. Include tamper-evident features. Offer counseling through phone, email, or writing. Be licensed as a Class D pharmacy if mailing into Utah from another state. Long-term care. This section will guide you through the key legal and procedural requirements governing how medications are stored, accessed, dispensed, and administered within long-term care facilities, or what Utah law refers to as Class B, pharmaceutical administration facilities. This is an important topic for pharmacists, technicians, and healthcare providers working in institutional settings like nursing homes, rehabilitation centers, and assisted living communities. Let's get started. Who can dispense or administer medications in LTC facilities? In long-term care settings, medication administration is limited to trained personnel based on the patient's ability to manage their own medications. If a resident is unable to self-administer or self-direct medication, facility staff may administer medications, but only after a licensed healthcare professional delegates the task. If the task is delegated to unlicensed assistive personnel, it must be done in accordance with the Nurse Practice Act and Utah Administrative Rule R156-31B 701. So, while nurses and other licensed personnel may directly administer medications, delegation is carefully regulated to ensure patient safety. Access to medications and dispensing units. While specific rules about who can access dispensing units are not detailed in Utah law, there is clear guidance on access to emergency drug kits. Only licensed physicians, physician assistants, or nurses employed by the facility may access medications in the emergency drug kit. The kit itself is considered a physical extension of the supplying pharmacy, and it remains under the pharmacy's ownership and responsibility. Labeling requirements, IVs. Every intravenous preparation must include all labeling required by 58-17B-602. The generic name and concentration of each active ingredient. For sterile parenteral preparations, the label must also include the name of the diluent, a lot number or compounding record number, the phrase, compounded preparation. Labeling requirements, unit dose. A unit dose is defined as the ordered amount of a drug for one-time administration and must display the drug name, strength, lot number, beyond use date. This ensures traceability and safety for every dose dispensed. Labeling requirements, multi-dose and repackaging for office use. Pharmacies may repackage or compound drugs for sale to practitioners under the following conditions. The drug is not a controlled substance, or, if compounded, must still comply with all legal conditions. It must be labeled for office use only. The practitioner can administer but not dispense the drug to the patient. The drug must be administered in the practitioner's office or facility. Controlled substances in LTC. There are no specific laws provided for who may access stored controlled substances or how exactly they must be stored in LTC settings, but general standards still apply. However, pharmacists must maintain detailed records of receipt and disposition, ensure controlled substances can be accurately reconciled, periodically review and reconcile all controlled substances records. The consulting pharmacist is ultimately responsible for oversight, ensuring all drug records are in order. Emergency dispensing requirements. Emergency drug kits in LTC facilities are tightly regulated. They are owned by the supplying pharmacy and must remain locked and secure. Contents are determined jointly by the medical director or director of nursing and the consulting pharmacist. A list of contents must be posted near the kit. Drugs in the kit can be used only for genuine emergencies when timely access to a pharmacy is not possible. Only licensed medical staff can access emergency medications. The pharmacy is responsible for maintaining inventory, storage, and records. All related records must be readily available for inspection by DPL and the Utah Department of Health. This level of control ensures both accessibility during emergencies and proper regulation. Record-keeping responsibilities. Record-keeping in long-term care isn't just a best practice, it's a legal requirement. The licensed pharmacist who consults for the LTC facility must provide guidance on all pharmacy services, establish a system for receipts and disposition of all controlled substances, ensure that every drug record is in order, regularly audit and reconcile inventory and dispensing activity. These responsibilities are defined in R 156-17B, 614C and are critical for preventing diversion and ensuring compliance. Nuclear pharmacy. This section will cover the special requirements for pharmacists and facilities that handle radiopharmaceuticals, medications that contain radioactive isotopes used for diagnosis or therapy, often in imaging or oncology. Nuclear pharmacy is a highly specialized practice area that requires additional training, oversight, and safety considerations due to the nature of the substances being handled. Let's walk through the legal and operational standards as outlined in Utah law. Pharmacist requirements, special licensure, and training. To practice in a nuclear pharmacy in Utah, it's not enough to just be a licensed pharmacist. The pharmacist must also meet additional educational and training requirements. Specifically, the pharmacist must complete classroom and laboratory training in nuclear pharmacy consistent with the requirements of the Utah Radiation Control Rules. This ensures they are adequately prepared to safely handle, prepare, and dispense radiopharmaceuticals, which carry unique risks due to their radioactive properties. Facility requirements, licensing, safety, and staffing. Now, let's look at the facility standards for nuclear pharmacies. A Class B nuclear pharmacy in Utah must meet the following criteria. The facility must either hold a current Utah radioactive materials license or have already applied for that license through the appropriate regulatory body. The pharmacy must have adequate space and specialized equipment that is appropriate for the level of radiopharmaceutical services it provides. This could include shielding equipment, fume hoods, decay storage areas, and radiation monitoring tools. The facility must maintain a professional reference library relevant to nuclear pharmacy. This ensures that pharmacists and staff have quick access to critical information on drug preparation techniques, radioisotope safety,
dosimetry,
regulatory requirements. Most importantly, a licensed Utah pharmacist must be immediately available on-site whenever the facility is open or engaged in the practice of pharmacy. This means a remote supervising model is not acceptable. A licensed professional must be physically present at all times to oversee operations. These standards help ensure the safety of both the public and pharmacy personnel, and they reinforce the importance of real-time professional oversight in handling radioactive materials. Dispensing standards, radiopharmaceutical quality. When it comes to the actual medications dispensed, nuclear pharmacies in Utah must ensure that only radiopharmaceuticals that meet acceptable quality assurance standards are dispensed. This includes compliance with federal regulations such as those from the U.S. Nuclear Regulatory Commission, NRC, and the U.S. Pharmacopeia, USP. including USP 825, which provides detailed guidance on radiopharmaceutical preparation, compounding, and dispensing. So, not only must the environment and personnel be properly equipped and trained, but every medication that leaves the pharmacy must meet stringent quality standards to ensure patient safety and therapeutic accuracy. Remote pharmacy practice. With the expansion of telehealth and digital healthcare delivery, the role of remote and automated pharmacy systems has become increasingly important, particularly in areas of need where traditional pharmacy access is limited. Today, we'll go over Utah's legal framework for automated pharmacy systems, remote dispensing pharmacies, and the roles and responsibilities of the pharmacists and technicians who operate them. Licensure and location requirements. First things first, is special licensure required for remote pharmacy operations in Utah? The answer is no separate license is needed beyond being a Class A or B pharmacy. Additionally, the physical pharmacy does not need to be located on the dispensing site. Pharmacies may use automated pharmacy systems or operate remote dispensing sites under the jurisdiction of the division, even if they're not physically on site. Automated pharmacy systems. Key requirements. Automated pharmacy systems are permitted in licensed pharmacies, remote locations under division jurisdiction, licensed healthcare facilities. They must comply with the following. Documentation requirements. Pharmacies must maintain detailed documentation including equipment type and serial numbers, site location, operational procedures and QA protocols, security, safety, and malfunction policies. Quality assurance. The system must ensure pharmacist review of prescriptions before dispensing, QA programs to monitor performance, security and access. Must prevent unauthorized access. Comply with HIPAA. Have detailed policies defining who can access medications and when. Data and records. All access events must be logged electronically, including who accessed the system, what was accessed, patient identity, drug details. Records must be kept for 5 years. Stocking and supervision. Stocking must be performed by licensed healthcare personnel, supervised by a pharmacist. Policies must be in place to ensure all drugs are properly labeled and traceable. Handling of controlled substances and waste. All controlled substances and unused/wasted drugs must be secured and accounted for according to state and federal law. Remote dispensing pharmacies. Operating standards. Remote dispensing pharmacies are allowed under Utah Code R156-17B, 614G, with several key requirements. Structure and supervision. Must be a Class A or B pharmacy. Supervised by a licensed Class A or B pharmacy, called the supervising pharmacy. Located in a designated area of need. May not perform compounding. Pharmacist oversight. The supervising pharmacy's PIC also serves as the RDPIC. One pharmacist may oversee up to 2 remote dispensing sites simultaneously. Technician supervision must be visual and auditory. Live video and audio feed is required. No more than 2 licensed technicians may staff a remote site without a pharmacist physically present. Each technician must have at least 500 hours of experience. Telepharmacy system requirements. Video and audio systems must cover the entire site. Enable secure patient counseling. Be HIPAA compliant. Allow the pharmacist to confirm drug product accuracy. If the system fails, the pharmacy must immediately close unless a pharmacist is present on site. Security and emergency planning. Entry logs must be reviewed regularly. Signage must inform the public they're using a remote pharmacy and where the supervising pharmacy is located. Emergency plans must ensure medication delivery or pharmacist arrival within a reasonable time frame. Notify the division if a pharmacist cannot arrive within 24 hours. Record keeping and inspections. Surveillance, excluding patient conversations, must be retained for 45 days. Controlled substance records must be maintained on-site. Monthly inspections must be documented by the RDPIC, retained for 5 years. Include temperature logs, inventory reconciliations, and entry record reviews. Other key remote practice considerations. Central fill. Yes, Central prescription processing is allowed in Utah. Pharmacies may engage in central fill arrangements under R156-17B 614F. Telework and out-of-state practice. Pharmacists are not required to have a Utah license if working for an out-of-state mail service pharmacy, as long as they are licensed in good standing in their home state, properly designated as the pharmacist in charge, PIC, of that out-of-state pharmacy. Medical offices. Let's discuss how medications are managed in medical offices under Utah law. This is an essential topic for both pharmacists and healthcare providers, particularly those involved in dispensing or administering medications outside of traditional pharmacy settings. We'll be discussing who can receive and store medications, how samples are handled, and under what circumstances providers can prepare, dispense, or administer prescription drugs. Let's dive in. Who can receive, store, and administer medications in medical offices. In Utah, certain healthcare providers are legally recognized as dispensing medical practitioners. These are individuals who are not only licensed to prescribe medications, but also authorized to dispense them under the Pharmacy Practice Act. The following professionals may qualify as dispensing medical practitioners: physicians and surgeons, osteopathic physicians, physician assistants, nurse practitioners, optometrists when acting within their scope of practice. These professionals must hold a license from the Division of Occupational and Professional Licensing, DOPL, specifically authorizing them to engage in the practice of a dispensing medical practitioner. Dispensing drug samples. What's allowed? Dispensing drug samples to patients is permitted, but with some important restrictions to protect patient safety and prevent misuse. According to Utah Code 58-17B-610, practitioners may personally administer or dispense drug samples to meet a patient's immediate need, provided that the sample is not a Schedule II drug, opioid, or benzodiazepine. The sample is prepackaged by the original manufacturer, provided free of charge by the manufacturer, given to the patient at no cost. The supply must not exceed 30 days, unless the prescriber documents a medical necessity for a longer duration. The container must be clearly marked as a sample. The name and quantity of the sample must be recorded in the patient's chart. This ensures accountability and aligns with best practices for drug safety. Can providers dispense and prepare prescriptions? Yes, Utah law allows dispensing medical practitioners to both prepare and dispense prescriptions under certain conditions, though there are limits. Dispensing medical practitioners may dispense cosmetic and injectable weight loss drugs if they were prescribed by the practitioner to their own patient and in accordance with rules established by DOPL. Dispense cancer drug regimens, subject to the provisions outlined in Section 58-17B-805. Dispense prepackaged drugs to employees or dependents at employer-sponsored clinics if the patient is part of an exclusive group of employers. The drugs are prescribed and dispensed at the clinic. The medications are administered on-site. This framework is governed by Title 58, Chapter 17B, Part 8, which covers the full scope of responsibilities for dispensing medical practitioners. Labeling, logging, and storage requirements. Although Utah law doesn't specify exact procedures for labeling, storing, or logging drugs in medical offices, it does state that dispensing medical practitioners must comply with administrative rules adopted by the Division of Occupational and Professional Licensing. These rules cover labeling and record-keeping, patient counseling, purchasing and distribution, operating standards, storage and quality of care. Practitioners should ensure their operations align with DOPL rules and consult their respective licensing board for guidance. Drug sources. Can pharmacies supply medications to medical offices? Yes, pharmacies can supply medications to medical offices, but under strict limitations. Under Utah Code 58-17B-624, a pharmacy may repackage or compound a prescription drug for office use only. Provide it only for administration on-site, not for dispensing to patients. Supply non-controlled or certain compounded drugs. Compounded drugs cannot be controlled substances. Label the drug for office use only. This rule allows practitioners to administer necessary medications without running a full pharmacy, while ensuring proper safeguards are in place. Miscellaneous pharmacy laws in the state of Utah. In this section, we'll be exploring some of the less centralized but equally important areas of pharmacy practice, including correctional facilities, emergency departments, veterinary dispensing, and patient care at discharge. These often overlooked settings have their own specific legal standards that pharmacy professionals must understand and apply. Let's begin. Correctional facilities, patient counseling. In most settings, pharmacists or pharmacy interns must provide verbal counseling to patients receiving medications. However, Utah law makes an exception for individuals who are under the jurisdiction of the Utah Department of Corrections or county detention facilities. According to Utah Code 58-17B-613, pharmacists may provide counseling via written, telephone, or electronic communication in these settings. This allows for flexibility while maintaining patient education and safety standards in secure or restricted environments. Veterinary and animal control dispensing. There are also rules related to animal control and narcotic detection training programs. These are outlined under R 156-17B, 617C, which provides the operating standards for Class E pharmacies, those that support animal control programs. Animal narcotic detection training. Although the exact details aren't specified here, what's important to note is that Utah law recognizes and regulates veterinary dispensing and training-related drug use under a separate pharmacy classification. Emergency room and urgent care dispensing. Let's move on to one of the most dynamic settings, emergency departments and urgent care. Under Utah Code 58-17B-610.5, medical practitioners may dispense medications directly to patients in hospital emergency departments, but only under specific conditions. The hospital pharmacy is closed. The drug is needed to meet the patient's immediate needs. Dispensing follows established hospital pharmacy protocols, and the practitioner dispenses only a sufficient supply until the patient can access a pharmacy. When it comes to controlled substances, the law imposes a strict limit. No more than a 2-day supply can be dispensed. Under Utah Administrative Rule R 156-17B, 610.5, further clarification is provided. Practitioners may give up to a 3-day supply of medication in general. 7-day supplies are allowed for STI prophylaxis. Naloxone kits may also be dispensed. Labeling requirements for emergency supplies must include prescriber and facility information, patient's name, medication name and strength, instructions, and beyond use date. And finally, controlled substances dispensed must be documented and reported to the Utah Controlled Substance Database via the appropriate pharmacy partner. Hospital discharge dispensing rules. In certain situations, a hospital pharmacy may dispense a limited quantity of medication to a patient being discharged. This is permitted under Utah Code 58-17B-600 and 10.6, provided the patient is discharged on the same day the drug is dispensed. The patient's regular pharmacy is closed or otherwise unavailable. The supply given is no more than a 72-hour quantity, and dispensing complies with the hospital's internal protocols and procedures. This exception allows patients to maintain continuity of care, especially after hours or on weekends, when traditional pharmacy access may be limited. International drug sources. Utah law currently provides no specific guidance regarding international drug sources. Therefore, pharmacists should adhere to federal law and FDA guidelines, which typically restrict the importation of prescription drugs unless certain exemptions apply. Pharmacy Benefit Manager, PBM, Oversight. Utah has taken steps to provide transparency and accountability in PBM practices. Under Utah Code 58-17B-622, PBMs are subject to rules regarding auditing of pharmacy records, standards of conduct, an appeals process for pharmacies subject to PBM audits or decisions. This ensures a more balanced relationship between pharmacies and PBMs and helps protect the financial and professional interests of pharmacies during audits or contract disputes. Thanks for watching Pharmacy Review. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell to stay updated on all things pharmacy. Got questions or suggestions? Drop them in the comments below. Until next time, take care and keep thriving in your pharmacy journey.